Hi, everyone. Welcome back to the Holistic Pharmacy Podcast. I have with me today a very special guest, Dr. 𝗣𝗵𝗿𝗃𝗂𝗏 Pattani, who is a pharmacy owner, a functional medicine practitioner, and certified CBD and autoimmune specialist. Hope I got all of that right. So I would love to dive into her story and share with you all how she got into all of these things. And it seems like she's constantly learning new things. We were just chatting before the show. So let's just start with what I ask everybody on the show, and that's how you got involved in pharmacy, how you grew up, and what got you interested in medicine and pharmacy in the first place.
Thank you so much, Dr. 𝗵𝗿𝗃𝗂𝗏, for for allowing me to be a guest on your podcast. I listened to it, so it's really a very big honor to be here. So thank you so much for that. And the how I got involved with pharmacy was actually very much by chance because my I have one older sibling and he elder sibling, and he went to medical school, and so I have really had the path really carved out for me my whole life. And I pretty much just did whatever he did because he's about 4 years older than me, so I would just follow in his footsteps, and then I wouldn't have to think about what I wanted to do. So when he went into medical school, that was pretty much my trajectory, that okay, well, I'll do 4 years of undergrad and then go for medical school as well. But then when I was applying for colleges, I didn't know where what all things to apply to, so I kind of just went by him, and I'm like, okay, well, he went to this school, so I'm going to go to the same school, which was Rutgers University in New Jersey. And so because Rutgers University had so many different colleges that you could apply to, I couldn't narrow down what I wanted to go to or what was a good pre-med college to attend. And so my brother just kind of guided me, and he said, well, why don't you pick College of Pharmacy as one of the schools? And I said, why would I want to do that? Like so, and he's I think he was just trying to pick on me because he did not get into the pharmacy program, and so he thought that I would also get rejected. But then I got in, and then the plan was to stay in pharmacy school for 2 years and then take my MCATs and transfer to the 8-year program at that point. But then I absolutely fell in love with chemistry, and then here we are. So so yeah, that's how my journey started in pharmacy. Did not like general chemistry much, but when it came to organic chemistry and biochem, I absolutely fell in love with chemistry. So yes, big nerd.
I love chemistry and I love general chemistry. So, but yeah, I totally hear you on just taking a chance, and then it just kind of goes from there. So it sounds like you had a pretty close relationship with your brother. I could feel the love there. And do you have any other siblings? And are you still in the same place where you grew up?
No, this was all in New Jersey, and now we're in Dallas. I'm in Dallas, Texas, and he's in Arizona. So everywhere, everyone's all over.
Yeah, got it. So talk to me about, your experience of pharmacy school, what you did after pharmacy school, and why you chose to move.
So pharmacy school was great. It was, I think, the first time that I'd ever lived away from home. So it's like any 20-year-old, right? Like 18-year-old, that leaves home for the first time, learning to be independent and figuring out your priorities and where you fit into the universe. And so that was interesting. Absolutely the best time of my life. And then after pharmacy school, I did retail for a few years, but I kind of got burnt out within like 2 years of doing that, like many people do, and actually got a stress ulcer while I was at work, and collapsed at the pharmacy on a Monday morning. And so I had to call the ambulance, but I didn't know what I had at the time. I was just in, incredible amounts of pain and could not stand, and had to call the ambulance, called my district manager, And they were like, can you hold on for 2 hours while I send a replacement?
Wow.
So like really learned very quickly like how little our life really means to other people, and like who really matters, in life, and everyone that we put on the back burner for our jobs, like, kind of learned that really, really quickly. So very thankful for that life lesson. But thankfully I was just like, no, I've already called the ambulance. So, if your replacement gets here before the ambulance, that's great. Otherwise, they can always reopen the pharmacy, when they get here. But I'm leaving. So then that's when I realized I had a stress ulcer. I had to kind of slow down a little bit and take care of myself. And then I went into kind of still retail, but like, continued on for another 2, 3 years. Then got married, moved to Florida with my husband, and continued retail, but it was a lot better, non-stressful experience. So that was kind of stayed with it. And then my husband decided he wanted to do law school. So we moved from Florida again to Virginia because he wanted to be in DC. Like, where else would you do law? And then I moved to clinical pharmacy in the hospital setting. And that was an amazing experience. It was about a 1,200 bed hospital. Learned so much. I'm a learner by heart, so I'm always, I get bored every 2 years if I'm not learning anything new in the role that I'm in. So I absolutely loved that because every day I was learning new things. So I was there for about 7 years. And then why did we move to Texas? We moved to Texas for my son because then my son was about 6 odd months, and the weather in Virginia was not very suitable for him. So this was also like my first look into functional medicine, but I didn't know that it was functional medicine at the time. So he was diagnosed with childhood asthma, and every 2 weeks we would be in the ER, and he would be struggling to breathe, and we would have to um, just give him so many doses of steroids constantly to help him. But nobody knew why, or things were happening. But I didn't know either because our training has always been in the Western medical field. So didn't know much about how to fix asthma. And at that time, with asthma being such a acute illness, like I wasn't gonna try something you know, holistic, even though I had met some people that were trying to tell me, like, oh, if you do this and if you do that. And I'm like, I can do those things. But when he's having an attack, I'm not going to be trying those things. I need to make sure he's breathing. So it did help to reduce how often the frequency that we would have to go to the ER. So I was thankful for that. But that cold weather in the Northeast was just not working for him. And so we moved to Dallas. And then as soon as we moved here, we were done with the ER visits, we were done with steroids, we were done with all of those things. So that was a big relief, especially because we're in pharmacy, we understand like, with such a young baby, when their like organs are still developing, and if we're starting to do steroids, like it's going to have some lasting consequences for his growth and how he handles everything else in life. And so that was it was, I think, the first time I realized how important the environment is, to your well-being. And like all these like small pieces were starting to come together, you know, because before that we never think about like what the environment's doing. You're just like, well, if you're cold, put on a coat, like, and it's not as simple as that. So that piece of the puzzle came together. And so we've been in Dallas since then. And when I came, I worked at another hospital here, and then um, kind of started seeing people like, they have these frequent flyer people that are in the hospital, that are in and out of the hospital like all the time. And I would always wonder like what is falling through the cracks when they leave the hospital in their care. So that was kind of always in the back of my mind. And so I started a consulting company where I would help people that are just discharged, and I would help them with the med reconciliation and helping them figure out like what they need to be on, what they don't need to be on. Because a lot of times when they go into the hospital, their meds will get changed to whatever's on formulary. And then they leave the hospital with all these new prescriptions, and then they may have the same or similar meds at home, which they don't understand. So now they're taking all these things that, and they don't see their primary, and and then they're back in the hospital. So I was kind of trying to bridge that gap for them. And now I think we have, right? We know that that's called transitional care. And I was almost just doing chronic care management and transitional care management, but back then there were no terms for it, I guess. So I had just made this up, and it was just a consulting company. And then did that for a while, worked with a bunch of physicians, and helped almost 500 people, like, and every single person that went through our program um, did not wind up back in the hospital in the, as long as they were with us, at least not for medication related reasons, like no drug interaction, side effects, none of those. So that was very rewarding. And then the physicians wound up not paying me for my services. So, hey, it's life, right? Like we don't always get to where we are in a straight line. So, um, because they were like local physicians, it didn't make sense to burn bridges with anybody. And I figured at that point that I would start my own pharmacy so I can have full access to how billing works, and I can get reimbursed for my time and my energy. And I would do it myself without relying on somebody else to sign that paycheck for me. So, and then here we are, pharmacy owner. This is our 4th year. And somewhere along the line, I met Dr. 𝗨𝗵𝗿𝗃𝗂𝗏 and like fell in love with that program because I was kind of already doing that with the med reconciliation and the chronic care management. But I didn't have like next steps to give people. So there was a little bit of a lag in what I was providing at the time. But then I was able to learn like, oh, that's called functional medicine. And look, there's all these schools that offer that program. And so went back to school. I'm still finishing up. So I finished my certification with Dr. Manoukian for functional medicine. And then now I'm enrolled at Functional Medicine University to complete my certification there. So I have about a year left in that. And then yeah, just learning. And then I just started another certification for Ayurvedic certificate in nutrition, as I was speaking with you earlier. But love to learn, love to grow, and then try to bring that back to my patients and my clients and whoever else that we come in contact with. So yeah.
Wow. Wow. Yeah. So thank you so much, first of all, for sharing all of that. It's a lot to unpack.
Yeah.
So let's go back for a second to your first foray into your stress ulcer, right? And realizing that stress is that root cause of so many things and illnesses, and it's real, right? Like it's not just stress in your head, it literally caused you to have an ulcer in your stomach and burn away at the lining. So so talk to me about like, what was going on in your mind then, and then like how you were able to then transition to another retail setting and then the hospital setting and feel less stress. Like how were you able to deal with the stress better after that?
So, I realized that what I was doing was not working. Like, the regular retail where I was with 14-hour shifts, being on my feet, not having time to eat or drink or use the restroom, like, these are, realize that that's not like normal and that's not conducive to long-term health. And so definitely took pay cuts, because when someone's giving you that kind of money, it comes like at the cost of your life almost. you know? So you really have to take a hard look at like the life choices at that point. And um, I had several other friends at the time that had independent pharmacies. So um, I did actually just quit after that, like, with regular retail, and I picked up some just random shifts here and there with friends at their independent pharmacies, and really started to fall in love with pharmacy all over again, because until, it only took like a year and a half for me to think that I had made a horrible mistake in pursuing pharmacy, because I didn't think that I could live like that for the rest of my life, like, doing those 14-hour shifts. So I thankfully I was able to see different sides of pharmacy, which kind of rekindled my faith in the profession. And then, this other retail setting that I went, it was a grocery chain, so it was a lot laid back, and I was able to implement. I got a job there as a pharmacy manager, so I had a lot of leeway to help make the changes that I wanted to make, and have that patient interaction with the patients that came into the grocery store and then the pharmacy. So I was starting to get all those things that you want to do when you go to pharmacy school, build those relationships with patients, and really have an impact on their health by guiding them the correct way, actually using the skills that we had gone to school for. So started to kind of really like pharmacy again. And then but yeah, then and after that, when I moved to Florida, I was still in pharmacy school. But yeah, you're right. The stress part does, it's not like a mental thing. We think that it's just in our minds, and until then I really thought that I was handling it really well, and I had no idea that it could come up as manifest itself as an actual illness. So it was eye-opening, like, to see what it can do. So, but self-care, learning that, like, you can't do anything or accomplish any big things if you're not taking care of yourself first. So can't pour from an empty cup.
Yeah, absolutely. I mean, we're not just a mind, not just a body. The mind-body connection is real. And our lifestyle and what we do for 8+ hours a day, and as you said, sometimes 14-hour shifts, it really matters. Like, you're living a high percentage of your life in a state of stress and not liking what you're doing and not getting a bathroom break. That
Hmm.
takes a toll. And then especially if you're not 100% aligned with how the care is given and what your role is, and feeling maybe lack of autonomy sometimes. That's how I felt when I was in retail. So
Hmm.
I can totally relate. And I know so many people that have stress ulcers from different types of work, different types of stresses. And then also in pharmacy specifically, like, there's a huge exodus now and a huge movement and a huge advocacy, because this can't go on. It's not sustainable to
Yeah.
have this sort of work life imbalance. It's not
Yeah.
balanced at all.
And then we make mistakes, and then people suffer, people's lives are on the other end of that. So yeah, I have, now that we have our own pharmacy, and when people come in and they say, "Oh, I hate so and so, this pharmacy, and that pharmacist has messed up my meds like 3, 4 times," and I'm just like, no, that's like really sad, because it's how stressed out that person might be to be making those mistakes, because I'm very sure, as a pharmacist myself, that I remember every single mistake I may have made in my, like, since I graduated in 2004. Now I'm dating myself. Like, so in the 18 years, I can count it on my fingers, like, how many times I may have made any mistake, whether it was like, a very serious one, or like something simple about, like, not having the right count in it, whatever it was. But I can, like, remember each of them, and those are very stressful for for people like us that really actually go into pharmacy because they want to help people. So um and I'm like, it's not fair that they're put in those situations where they have to um not be 100% sure of, like, the care that they're providing.
Yeah,
Yeah.
absolutely. And how was it different in the hospital setting as far as stress level? Like, hospital, we think about acute care, right? And you were saying, people are in and out, sometimes back in. So, was that part stressful? How did you deal with, being in an acute care setting?
So yeah, I mean, when we were at a code blue or something. That part was, of course, stressful because everyone's looking at you to have the meds ready to give at the time. But I think that was just about having more practice then, and like anticipating, like, okay, this is what they're going to need next. So I would already have it ready. So then it wasn't very stressful. What I really loved about my time there was I wasn't being forced to do things in exactly this much time or that much time. Like, if I'm working on a patient or a new admission or any of those things, like there was no one like watching every moment of my time that I had to finish this work in 3 minutes, and then because then I can't look at everything I need to be looking at, and I had the time to make sure like I was doing the right thing by the patient and that I was looking through all the drug interactions and the meds and their renal function and their liver function and like checking for the labs and checking for, so that part was really really great. And I still remember, and this was about like maybe 12 years ago now, but I still remember when I was first training for that hospital job, because I had not worked in the hospital setting then. And one of the senior pharmacists, that was working with me or helping train me said, that we're not monkeys here, and it was kind of like, what? And she's like, our job is not to just blindly fill orders that the physician has written, because any monkey can do that. Like, you're here to think critically and advise them, and it's okay to pick up the phone and say, hey, like, do you think that we may be able to benefit better with this or that, and be an integral part of the team, and which was really different because nobody had asked me to do that before, and no one cared that I could think or I could contribute or um you know based, especially in the retail setting, right? Because there's no time for any of that. And it's not like if you took 10 minutes to fill a prescription, nobody would come and pat you on the back like, oh, great job, you prevented that drug interaction. They would be like, well, you could have filled 8 more prescriptions in the time you wasted. So so that part was you know I think like when you are finally like aligned and feel like you're really helping, then it helps to alleviate that stress level too, because because you're really aligned with what you're doing, and now you're starting to really enjoy your work, and you feel good about the outcomes that you're getting for your patients. And so that part was, I think, really great about the hospital.
Yeah, the fulfillment. So yeah, when you feel like you are making a difference, and when you do have a little bit of that autonomy that we mentioned before, it feels very, very different than just being a monkey and feeling things blindly. So I love that analogy. And I would love to ask you, nowadays it's so challenging, right? The pharmacy industry and especially the retail setting to compete with chains. And, there's only like a couple of big chains that really compete nowadays. And how, difficult was it for you to start your own pharmacy? Like, how did you decide to do it, right? And take that risk? And how are you able to monetize it and differentiate yourself from other pharmacies?
So that's a great question. So I think like I started the pharmacy because like I wanted to be um I think back in my mind I always had that idea that I wanted to be that kind of pharmacist where the person's family, like their grandparents, parents, kids, pets, everyone, and they really trust you to come to you for things that are going on in their lives, and that you can have that positive impact and help guide them through that journey. So that was kind of always in the back of my mind. I think the biggest part was I wasn't always a fan of being in a box, in that pharmacy like all day, because I am such a people person that I felt like I needed to be out and about doing things, meeting everybody, doing what we're doing, right? And I felt that if I started the pharmacy, that all that would not happen anymore. So our pharmacy is beautiful, like, it's designed by interior designers and things. And so when people walk in, they're like, oh, this doesn't feel like a pharmacy. So it's a very pretty box, but it's still a box. And so I found ways to, still do my consults. I absorbed my consulting business into the pharmacy so I could still see patients with chronic care and transitional care management. So we still do that. Created office spaces there so we can still have people coming in to do their consults there, and then slowly started like implementing like the vaccine programs. I'm an avid traveler too, so I love to just travel everywhere. So I do a lot of work with people if they're going to different places. Like we're also like a travel vaccine clinic type of thing. So if they come and tell me, okay, I want to go to Africa, then we like kind of help look. We do consults for that and help them figure out like, okay, these are all the vaccines you may need, and help get them set up for their trip so that they can have a nice, safe trip for that. So, and then also create different like niche items, like, different first aid kits for different parts of the world that people may be traveling to and things like that. So, it's been fun to kind of come up with like different new ideas. So I actually don't see the big retails as any competition at all, because what they offer is so different from what I offer. And sometimes, like, even our patients are okay with paying a little bit more to come to us because they get that service, and because they get someone who, when they walk in, we're all like, hey, Mr. So and so, and they're like, oh, I'm not like some number, and I don't have to give my date of birth and my last name and my first name and my ID like every single time I come in. So that's been kind of really great. And then our niche now is, we do hospice a lot, and compounding. So then that there's really no competition when it comes to that with any of the bigger places. So yeah.
Yeah, well, it sounds like, you're very service oriented and you're creating solutions for people's problems, and your creativity seems to have no bounds. So congratulations on all of those services.
Thank you.
For anybody listening, there's some ideas out there that maybe you haven't considered. And how are you integrating the functional medicine piece now into your work?
Well, the first thing we did was changed all our outgoing messaging to the patients, and we kind of let them know that, hey, did you know that your favorite pharmacists are also now, certified in functional medicine care? So if you want to know more, like, please ask. So it was very simple, because like you're already servicing people and they're calling you like all day. So that was a great way to kind of let them know. And then we put up different posters and things around to figure out like, hey, how do you figure out like what supplements they're taking? Or if we see anybody buying any random supplements, then we're like, well, how do you know that you're supposed to be taking this? Or, and they're like, oh, I don't know, so and so told me it worked for them. And I'm like, that's not how you figure out what supplements you need to be taking. Like, your body is very different from somebody else's body. And so that kind of gets those conversations going. And then just educating your team, that's what we meet them where they are. Like, you can't drag people to health, and you can't you know force them to be healthy or anything like that. The only thing we can do is let them know that, hey, whenever you're ready, these are all the different services we do offer. So whenever you're ready for that, then we're ready to, like, walk this journey alongside you and be your guide. So that's pretty much all we're doing. So I can't sell anything for it forever. So I'm just like, I've become a lot better at um like kind of helping figure out like if that's going to be the right client for us or not, because not everybody that walks through is going to be your client, whether it's in the pharmacy or in the and that's okay, because you learn who your audience is, and you learn what your value is, and who is ready for that and to receive it, and who's not ready to receive it. So it took a long time to not take that personally. But, yeah.
Love it. And could you also share how your chronic disease management clinic is different from the functional medicine services? If you could just talk a little bit about how you charge for them and then what's included.
Oh, the chronic, okay, yes. So the chronic care management is very different. Like we are, so on our pharmacy side, we did get credentialed to be a wellness clinic as well. So now we can bill for some of the services as a medical office would. So now we just, and then we have so we build that completely separately, and that's really just focusing on the medications that they're on and the disease states that they're on, and we're helping them figure out, like, well, if the meds that were prescribed to them are serving the purpose that they were just prescribed for. Has it already served its purpose? How long they've been on it? Like, are they seeing the results that they thought they were going to see with that, and so on, and so so it's based on those checklists and questions. And then if it's not, then we'll call their physicians to help work with them, so that it could be an interdisciplinary team for that patient, so that they have a whole team of people that are rooting for them to be healthy. So, and then when they do come in for that, we do tell them that, hey, what you're doing is fine. You're working with your physicians. That's fine. If and when you're ready, we also work with them to help them figure out the root causes of why their body is experiencing what they're experiencing. So, but the functional medicine part is not covered by insurance. So we do let them know those things, and that it's not for everyone. So, because not everybody has the means to be able to do everything out of pocket. So, so we let them know, and then, if they're ready, then they can come to us. If not, we say we'll still follow you along on this journey and try to do the best that we can with the physicians that you're working with already. So, because they all don't talk to each other. They all prescribe things. They don't care if things are, having side effects with each other. So we've, it's been like fun to navigate those waters, because you call one physician and you're like, would you like to change your medication because it's contraindicated with this other medication that this patient is already on? And they're like, no, I don't want to change the med I prescribed. Call the other doctor and have them change their med. And then you're like, okay. And then, like, you call the other doctor and they're like, no, I don't want to change my med. And I'm just like, okay, so I just want to get this on writing, that I'm documenting this, that you are now aware and still don't want to change it. And then they're like, let me think about that again, because now it's being documented, so it's just like, being that fierce advocate, I think, for your patients, and they see the fight that you fight for them. So I think it's win-win no matter what, right? So yeah.
That's the good fight.
Yeah.
All right. So from the functional medicine side, what is your specialty, and do you do any testing, or like what does your service look like?
So on the functional medicine side, I do specialize in autoimmune, and the reason for autoimmune was also kind of based in my son's health himself. Like, when he was younger, as I mentioned, and had childhood asthma, and he was always being given all these steroids. And so I feel like that's the same thing we do for autoimmune. We don't know what caused anything. We don't understand why our body is reacting the way it is. So we just try to suppress everything and put band-aids by giving steroids. And so that is a pet peeve. Like, you see someone on that and I'm like, no, we're not going to do this. Like, let's try to help figure out why your body's reacting this way. And so I did come up with the Pattani protocol, which is a very structured way that we guide the patients through each step to help get to the bottom of what that root cause is of whatever that they're suffering from. And then we try to help them overcome some of those, because at the bottom of everything, or at the root cause, we know that stress and inflammation is at the core of everything, but we don't know what about that person's lifestyle is, adding to that stress or that inflammation. So it's always a detective game when it comes to that. So we do offer testing, all kinds of testing actually, but I know that that can really rack up a bill for a person because functional tests are not covered by insurances. So I just try to work with a person's budget and see what they want to do, So they may say, these are my top 3 problem areas. And then, when we do the detailed intake, I can suggest, yes, that's a great place to start. Or I may say, no, I think that this is at the root cause of it. Let's try to address that. And then I think your other problems that you're saying may fall into place if you help with those things. So I help guide them along that process the best I can. And sometimes people will be like, no, I don't have the budget, so I'm okay with the trial and error. And I'm motivated enough to follow through with it. So then we go that route. And then, but most times when people come to me, they're like, well, I've kind of lived with this autoimmune for like the last 20 years, so I don't have any more time. And I wanted to feel better yesterday. So I don't care whatever it costs. Let's just get to the bottom of things and get healing that way. So then we would go ahead and order the tests and whatever we need to. So it really helps to guide the treatment plan a little bit better. But that's and we work a lot with mindset, because I think that was one of the bigger challenges, is like when someone has been taking all these medications to just survive on the day-to-day, that process of every day taking a pill or taking 10 pills like does something to a person's mental health, right? Like all of a sudden they're thinking that they can't survive without this, or that they need this, and it really it's not that easy to overcome that barrier. When someone like me or you come into the place and say, hey, by the way, you don't need these things, and you can just give your body the right things and it will start to heal itself. And then they're just thinking that you're doing some woo-woo stuff. So so that is like, a process, and that mindset is not like helping them with that mindset and overcoming um, is a big part of the plan itself and the treatment that we take them through. So it's been really, really an awesome journey to see the healing and how quickly our body responds to the things that it's been craving for, because every symptom, every time things are not going our way, it's our body's way of telling us that something is off. So when you start to give it things that it needs and was craving, it starts to fix itself really quickly, so it's fun to see that in action. And then your clients coming back and telling you like, oh my God, I didn't know that's all it needed. Like, I'm like 80% better or 90% better. And it's like music to your ears at that point. So very rewarding, fulfilling.
Yeah, definitely deep work and healing work. And so what's next for you and your practice and your business?
What's next? What's next is I have to find someone who will run the pharmacy so I can travel the world. Like travel is very deeply rooted in both myself and my husband. It's something we really crave for. And just learning about how different people do life differently, and how we're all just different on the surface, but deep down we're all the same, and learning just and so that's the favorite part about it. So once I have my clientele kind of built up, and then we can I can see them from anywhere in the world. So I can have my clients and my calls scheduled on Zoom or Skype or whatever, and then be traveling and see who else we can help along the way, and everyone that comes in contact with us. And be in alignment. I think all this really brings things into alignment. That work-life balance, like being able to spend time with the kids, teaching them like what is really important in life and what's not, and hoping they turn out to be good people, good, kind people. I think then so life could live like well lived or something. Yeah.
Yeah.
Mhm.
Well, I can't imagine them not turning out good with a caretaker like yourself and
Yeah.
leading
Thank
by
you.
your example. and approaching things with playfulness and curiosity, it seems like, and lots of gratitude. So I want to thank you so much for coming on. And if you have just one more minute, I'd love to do a rapid fire round of questions for you.
Okay. All right. Ready.
Okay.
Yes.
All right. Question number one, what is your number one advice for people that they could do right now to feel better?
Take an inventory of what your day-to-day looks like. Because if you don't know what you're doing, then you can't fix anything and go to where you want to be.
Yeah, awareness.
Mhm.
That's awesome. Love it. Question number two, what is a surprising fun fact about yourself?
Surprising fun fact about myself. Okay, here's one. I got to my senior prom in the back of a police car. More
Wow.
on that later.
Yeah, that's unexpected. Unexpected twist. All right, love it. Okay, question number three, what is your favorite self-care routine?
Favorite self-care routine is sleep. I try to get like at least 8 hours of sleep. If I don't get my sleep, I'm not a fun person to be around. And I do my walks every morning. Like my walk and my yoga practice in the morning is key to like my sanity through the rest of the day. Because all that extra chatter that's in my brain comes out during all that time, so I can kind of just breathe then after. So
Well, I love all of those. And even though you sound like an extremely busy and motivated and ambitious individual, I love that you make time for these things and fill your own cup, as you've said. And again, thank you so much for sharing your story and your wisdom with us today. And please tell the audience how they can learn more about you and support your work.
thank you so much for having me here, Dr. 𝗵𝗆𝗄𝗂. And the best way to get in touch with me is through my website. It's dr.𝗣𝗵𝗿𝗃𝗀𝗃.com. And I'm also on Instagram as dr.𝗣𝗵𝗿𝗃𝗀𝗃. I'm on LinkedIn as same name, Dr. 𝗣𝗵𝗿𝗃. Or you can email me at allenpharmacist@gmail.com.
All right, awesome. Well, I'll have all of those in the show notes. Thank you again, and I wish you a great day ahead.
Thank you so much, Marina. Appreciate it.